What causes liver inflammation? Liver inflammation, also known as hepatitis, is a common condition that affects millions of people worldwide. It is a serious health issue that can lead to various complications if left untreated. Many factors can contribute to liver inflammation, including viruses, alcohol consumption, and certain medications. Understanding liver inflammation, symptoms and diagnosis. Liver inflammation, also known as hepatitis, can present with a range of symptoms and is often diagnosed through a combination of medical history, physical examination, and diagnostic tests. The symptoms of liver inflammation can vary depending on the underlying cause and the severity of the condition. In general, some common symptoms of liver inflammation include fatigue, abdominal pain or discomfort, yellowing of the skin and eyes, jaundice, dark urine, pale stools, nausea, and vomiting. However, it's important to note that some individuals may experience no symptoms at all, especially in the early stages of the condition. When visiting a healthcare professional, they will ask about your medical history, including any risk factors such as exposure to viruses, excessive alcohol consumption, or recent medication use. They will also conduct a physical examination to assess any signs of liver inflammation, such as an enlarged liver or tenderness in the abdomen. To confirm the diagnosis, your healthcare provider may order specific blood tests to check for liver enzymes, viral markers, or antibodies that indicate liver inflammation. Imaging tests, such as ultrasound or a CT scan, may also be recommended to evaluate the liver's size and structure. Common causes of liver inflammation. Liver inflammation can be caused by a variety of factors. Understanding the common causes of liver inflammation is important in order to prevent and treat this condition effectively. One of the most common causes of liver inflammation is viral infections. Viruses such as hepatitis A, B, and C can directly infect the liver, causing inflammation and damage to the organ. Other viruses, such as the Epstein-Barr virus and cytomegalovirus, can also lead to liver inflammation. Excessive alcohol consumption is another major cause of liver inflammation. Alcohol is toxic to the liver and can cause inflammation and scarring over time. Chronic alcohol abuse can eventually lead to alcoholic hepatitis, a serious condition that requires immediate medical attention. Certain medications and toxins can also cause liver inflammation. Medications such as acetaminophen, antibiotics, and nonsteroidal anti-inflammatory drugs (NSAIDs) can potentially damage the liver and trigger inflammation. In addition, exposure to certain toxins, such as industrial chemicals or mushroom toxins, can lead to liver inflammation. Potential long-term complications of liver inflammation. Liver inflammation, if left untreated or poorly managed, can lead to several potential long-term complications. These complications can significantly impact an individual's health and quality of life. It is important to be aware of these potential complications and take necessary steps to prevent or manage them. One of the most serious complications of liver inflammation is liver fibrosis. When the liver is inflamed, it undergoes a process of scarring and tissue damage. Over time, this can lead to the development of fibrous tissue, which can impair the liver's ability to function properly. If left untreated, liver fibrosis can progress to a more severe condition known as cirrhosis, where the liver becomes severely scarred and its functions are significantly compromised. Cirrhosis can have a wide range of complications, including portal hypertension, which is high blood pressure in the liver. This can lead to the development of varices, which are enlarged veins in the esophagus and stomach that can rupture and cause life-threatening bleeding. Other potential long-term complications of liver inflammation include liver failure, where the liver is no longer able to perform its vital functions, and an increased risk of developing liver cancer, known as hepatocellular carcinoma. To prevent these complications, it is crucial to seek early diagnosis and appropriate treatment for liver inflammation. This may involve lifestyle changes, such as avoiding alcohol and maintaining a healthy weight, as well as medications or other interventions to manage the underlying cause of inflammation. Regular monitoring and follow-up with healthcare professionals are also important to detect and address any potential complications early on. Hit that like button and subscribe to stay updated with our latest content. Preventive measures and treatment options for liver inflammation. Preventing liver inflammation and seeking appropriate treatment are essential for maintaining liver health and preventing complications. Here are some preventive measures and treatment options to consider. 1. Avoid excessive alcohol consumption. Alcohol abuse is a major cause of liver inflammation. Limiting or avoiding alcohol altogether can significantly reduce the risk of developing alcoholic hepatitis or cirrhosis. If you need support to quit drinking, consider seeking professional help or joining support groups. 2. Vaccination. Vaccines are available for certain types of viral hepatitis, such as hepatitis A and B. By getting vaccinated, you can protect yourself from these viruses and reduce the risk of liver inflammation. 3. Practice safe sex and avoid sharing needles. Hepatitis B and C can be transmitted through sexual contact or sharing contaminated needles. Practicing safe sex and using clean needles can help prevent the spread of these viruses. 4. Follow medication guidelines. Some medications can potentially damage the liver and trigger inflammation. Follow your healthcare provider's instructions when taking medications and be cautious with over-the-counter drugs. Avoid exceeding recommended doses and seek medical advice if you experience any side effects. 5. Maintain a healthy weight and eat a balanced diet. Obesity and non-alcoholic fatty liver disease, NAFLD, are linked to liver inflammation. Adopting a healthy lifestyle, including regular exercise and a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, can help prevent NAFLD and support liver health. 6. Regular checkups and monitoring. Regular visits to your healthcare provider can help detect liver inflammation early on. They can perform routine blood tests to monitor liver enzymes and evaluate your overall liver health. 7. Treatment options. The appropriate treatment for liver inflammation depends on the underlying cause. For viral hepatitis, antiviral medications may be prescribed to suppress the virus and reduce inflammation. In cases of alcoholic hepatitis, complete abstinence from alcohol is essential. Medications may also be used to manage autoimmune hepatitis or other underlying conditions. Maintaining liver health, lifestyle changes, and healthy habits. Maintain a balanced diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can support liver health. Avoiding processed foods, sugary drinks, and excessive amounts of saturated fats is also important. Including foods with liver protective properties, such as garlic, turmeric, and green tea, can be beneficial. Stay hydrated. Drinking an adequate amount of water helps flush toxins from the body and supports liver function. Aim for at least 8 glasses of water per day. Exercise regularly. Engaging in regular physical activity helps maintain a healthy weight, reduces the risk of obesity, and promotes liver health. Aim for at least 150 minutes of moderate-intensity exercise per week. Limit alcohol consumption. Excessive alcohol consumption is a major cause of liver inflammation. If you choose to drink, do so in moderation. Women should limit their alcohol intake to no more than 1 drink per day, while men should limit it to 2 drinks per day. Quit smoking. Smoking not only damages the lungs but also harms the liver. Quitting smoking is crucial for overall health and liver well-being. Practice safe sex and avoid risky behaviors. Engaging in safe sex practices and avoiding sharing meals can help prevent the transmission of hepatitis viruses and reduce the risk of liver inflammation. Minimize exposure to toxins. Limit your exposure to harmful chemicals and toxins, both at home and in the workplace. Wear protective clothing and follow safety guidelines when working with chemicals or potentially hazardous substances. Manage stress. Chronic stress can have a negative impact on liver health. Engage in stress-reducing activities such as meditation, yoga, or hobbies that bring you joy. Before you leave, don't forget to like and subscribe to our channel for future interesting videos like this.